Hello guys, good morning, good afternoon, good evening, depending on where you're watching this video from. I'm Dr. Chukwemeka Precious, annual with Dr. Chuks. I promised I was going to start a series on preconception, antenatal, delivery, and also postnatal care. So I'm glad to let you guys know that this is the first video, the first episode. So this episode will just be like an overview and introduction on preconception care. Preconception means before conception. So there are things to consider before conception. However, I want to point out that in this our generation, a lot of women or a lot of couples, not the women, the couples have them, they are anxious of conceiving sometimes 2 months, 3 months into after their marriage or after having regular intercourse. Now, I'll say this: in those days, and even till today, we like to give couples a year of having regular intercourse before we begin to investigate. Investigate means before we begin to do tests and find out why maybe pregnancy has not taken place. And now, I said a year of regular intercourse. Now, this is for women married, the couples, as a woman, if she's less than 35 years. But for those above 35 years, we may want to give them lesser than a year, maybe 6 months. You understand? However, there's time that is given for these couples to have regular intercourse before, as a doctor, you begin to check. You do tests on either the man or the woman to find out where the problem of conception is coming from. However, in our generation, you find out that people are too anxious. After 2 months or after 3 months of marriage, some even after a month, they begin to run to the hospital and say, why is she not pregnant? Why are we not? The rush is too much in this generation, maybe because of technology and everything. But then in medicine, you still respect nature. You allow nature have its course first before you begin to intervene medically. So yes, I talked about regular intercourse. Someone will be saying, what do you mean by regular? Regular means for the couples to meet at least 3 times a week. In easiest term, every other day, since you have 7 days in a week, if they have intercourse every other day, at least they will meet up to 3 times or more a week. You understand? So that is regular intercourse. So a couple is better to have regular intercourse for a whole year. You understand? Unprotected, though. First one will be unprotected and none of them using contraceptives for a whole year and no without conception, or like I said, those above 35 years, but especially for the women, not the men, the women. Above 35 years, 6 months, it's okay, not a year. Then before you begin to intervene with tests to find out why they have not conceived. So if you're among those categories that troubling people after a month or two of getting married about pregnancy, I beg, they calm down. Don't put too much pressure on them. I'll talk more in the next video. For now, see you next time. Share and more videos. You can subscribe on my YouTube channel for more videos. See you next time. Bye.